Hi, everyone. So today we're going to have the pleasure of interviewing Dr. Corey Hillman. He's a doctorate in physical therapy based in Greensboro, North Carolina. So first of all, Corey, tell us a little bit about yourself.
Yeah, well, thanks for having me, Rebecca. It's really good to be here and talk with you. Um, yeah, so like you said, I'm a physical therapist, and I own a private practice here in downtown Greensboro, North Carolina. And I've been open since October of 2020, which is a little over a year now. And it's been a fun ride, to say the least, of kind of opening up right in the midst of the pandemic and everything like that. But it's been a fun ride and a good ride, and it's been wonderful to kind of try to bring a different type of care and a different view of physical therapy to the Greensboro community.
So what would you say makes your practice unique?
Yeah, so a couple different things. First, I know that people kind of come to the term physical therapy with a lot of different ideas and maybe images. But one of the things that is unique about my practice, particularly, is just it's just me and just the client or the patient each time. So I have a small treatment space here. It's not a large gym or a big noisy room or anything like that with tons of other different patients. When you come see me, it's just you and I for an hour. We kind of do really just kind of allows us to have more personal time, more time to kind of get kind of drill down some of the issues that clients are facing, but even more so to kind of focus on the goals. So, working on specifically like what is it that the client wants to do, whether that's something as simple every day as like going to take a walk without having a knee pain bother them, or whether that's I work with a lot of kind of higher performing kind of recreational athletes, like people that are doing yoga, people that are doing some CrossFit, or even just kind of general wellness stuff. And so the great thing about having that time with people is to really drill down kind of a specificity to what is it you want to do, and then working from there.
So it's very client-led.
Absolutely, yeah.
And I know you mentioned working with people with yoga.
Mhm.
Tell me about I know you personally have a love of yoga and you
Yes.
hope to bring that into your practice in future. Tell us a little bit about yoga and why you think it's important.
Yeah. So I've been into a student of yoga for the past couple of years, mainly through my wife. My wife has been doing yoga for quite a while, and she always talks about how was just kind of selling me on how centered it makes her feel, how present it makes her feel in her body. And in the past couple of years, I've been joining, kind of through the pandemic and stuff, really joining her in some of that practice. Virtually at first, and then more now back in the studio. And it was kind of that, as well as tons of my clients that were coming in were all, uh, practitioners of yoga or students of yoga, or had interest in doing it. And I think that, yoga is kind of one of those things that we talk about. Oh, it's just about getting a certain pose or a certain stretch, but really getting to see that yoga is, more of an ancient practice that kind of, we talk often about like that mind body connection now in Western healthcare, and for good reason. But yoga has kind of been presenting this for thousands of years. And so, both from a personal standpoint as well as kind of the clients that I was seeing, I've been working on getting my certification in yoga in the past year, and I'm looking to finish that up to soon be a registered yoga teacher. And so I'm really excited about incorporating components of that into practice here. Like I said, both since we talk about pain being a very kind of multi-dimensional thing of a mind-body experience. And so to be able to incorporate that within sort of the traditional physical therapy mindset, I think has a lot of advantages to the client.
Yeah, and that, as you said, the connection to the mind and the body and listening to your body. In our profession, intuitive eating is really a
Mhm.
popular and fantastic approach. How does the connection to listening to your body tie in your work?
Yeah, it's a great question. And you talked about intuitive eating, and I know that you and I have had numerous conversations on kind of both this intuitive approach to healthcare, and it's certainly sort of the thing too of like intuitive movement. Um, while I was talking about that, I do have clients that are very health conscious and want to, get back to yoga or their certain workout routine. That's not the only person that I see. And so I think often people have this approach to movement of like, I either am an Olympic weightlifter, or I can do handstands in yoga, or I should just, keep doing my sedentary lifestyle, or yeah, there's sort of a barrier to entry.
Mhm.
And I'd like to encourage people that that's not the case. So from a scientific standpoint, we now know from the research that like, something that I'm sure you see people come into is like this, idea of weight loss and dieting and stuff like that. And people come to me as well, like, how can I lose weight? How can I kind of gear a workout routine towards losing weight? Um, and I really encourage people that we know that movement independent of body mass composition still has just a plethora of health and wellness benefits, as well as like psychological and sociological benefits. And so just encouraging someone like, even if what you're doing for movement, even if it's a consistency of all I'm doing is taking a 5-minute walk in the evenings, a little bit harder now with the time change, but even if it's something like that, like that is still something that is contributing to your health. So I think just empowering people to move in small ways and just to tweak little things in their life, and not to feel like that they have to all of a sudden go out and become, the next Arnold Schwarzenegger or anything.
Yeah, and I love that when you said you worked with people, it was about getting back to basic everyday activities that by and large we probably take for granted until we have an injury or we
Mm-hmm.
need, rehabilitation after surgeries.
Mm-hmm.
Suddenly, wow, I can walk up the stairs, or I can pick up the groceries, or I can, I have the strength to lift up onto the cabinet because I'm short to reach something high.
Exactly. Yeah.
So, trying to, enjoy the small everyday movements in daily life.
Exactly.
That's,
Exactly.
I love that. Yeah, it doesn't have to be all or nothing.
No, absolutely not. And kind of like I was saying before, of like that's one of the things that kind of one of the missions of this practice is to meet people where they are and to help them achieve what they want to achieve goal wise, and not just, oh, Corey's come up with an idea that you should be able to do this, but you know putting the client really in the driver's seat.
So when it comes to weight, what non-weight related goals would you kind of steer them towards when they ask that question? How do you handle that?
Yeah, I mean, there's obviously, books have probably literally been written on this topic. Um, but I would say that one of the things that I kind of redirect with is just, again, of kind of focusing on the movement as being the goal itself, and not necessarily, you know, a decrease in weight or body composition, because we obviously know there's tons of different factors that go into body composition, independent of both diet and exercise. So really encouraging people to think primarily of the movement itself, of getting, if we think about something like walking, walking something that we, often take for granted and don't think about. But I mean, if there was one exercise I could tell people to do, it would be to walk if they can, because we know there's just so many benefits from that, whether it's from the fact of like putting weight through the joints, challenging the muscles and stuff like that, working joints through their range of motion, the cardiovascular benefits. And again, kind of those mental, emotional, and even spiritual benefits of like just being out. I know you and I both share a love of nature and just being out in nature and just enjoying a walk. So I think, again, just to kind of recap on that, just bringing it back to like the movement is the goal, not necessarily the physical, in the physical changes that you and I can see externally.
Yeah, because a lot of the magic happens within.
Exactly.
And I love that, like, as I say, nature. I love the concept of mindful walking. So I'll often tell clients, like, try and spot like a few things, what you notice, because so oftentimes we're just so caught up in hustle and bustle, we miss what's going on around us. And actually, the more you notice, it's kind of sad. Like we took flights over the Thanksgiving weekend, but when you stop in an airport or busy place and people are waiting, 98% of people are like this.
Oh yeah.
And even my kids, I mean, it's like, wow, it really hits home, because you're like, wow, I'm guilty of that sometimes. And they're like, wow, look, everybody's on their phone. And even when you're walking, people are checking their messages and stuff.
Yeah.
So trying to notice, like, what are the clouds like? What's the birds singing? You know, is there any flowers in bloom?
Yeah.
Oh, I know I'm always go off track, but tell us about the work you do with the greenways and the parks in Greensboro.
Oh yeah. Yeah. I mean, so one of my strong interests, even before getting directly into this profession, was just kind of built environments, and how, and by that I mean just like, how is the layout of our cities and our streets and our neighborhoods affect our ability to live out things. So one example that I give is, if you think of like streets. So here in Greensboro, like Wendover Avenue is one of the busiest streets. And especially in a certain portion of it, it's built kind of like an interstate. You know, there's not, you know, there's exit ramps, there's no stoplights. So it just naturally, even if you're, you know, maybe a more conservative driver and don't speed, it naturally kind of encourages you to speed. And I think the same thing exists like with, you know, within our, you know, other parts of city design. So whether it be like areas that don't have sidewalks, well, of course, it's going to encourage you not to walk because it doesn't feel safe. And so one of the things that I'm really excited about is, you know, working with the Greenway. So I've been on one of the Greenway committees for a while, specifically kind of the education committee. And that's been to educate people on the specific construction of the downtown Greenway here in Greensboro. And I'm really excited about that. It's been in the works for years, and actually some portions are open now, but it's going to be a 4-mile loop that will go around downtown Greensboro. Available for obviously cyclists, walkers, runners, just your, you know, someone going out in nature. And the beautiful thing about it is it's going to connect to other parts of the trails within Greensboro. So the A and Y Greenway and some of the other greenways will all kind of connect at this downtown Greenway and serve as a hub. And so I think it's just one way that the city itself is trying to push towards making the pedestrian experience and the ability to actually have alternative means of transportation more of a reality.
So people could essentially cycle to work?
That's some of the hope, yeah. And that's some of the hope for, you know, me personally, living a couple miles away and having a way to more safely come into work. Because like I was saying before, this area is not highly conducive for biking or walking places, but the excitement of new projects like this give me hope of where we might be headed as a community.
Yeah, I love that excitement. I remember I used to live in another neighborhood in Winston, and they built like a little, Winston's got a similar goal, I feel, as Greensboro.
Yeah.
They seem to have a similar mindset as city planners. We have a lot of greenways, and I think the goal is to connect them all over time too. I remember once they built this little creek greenway, like a stretch along a creek and connected to the back of the mall. And I remember getting so excited, and you probably do too, when you see the diggers and them laying the path, you're like, yeah.
Yes, absolutely. Yeah, there's a certain portion coming up of the Greenway starting on Battleground, and every time my wife and I drive past that point, I'm always making some comment. She's like, yeah, I know it's coming. Like, one of these days, it's going to be here.
But it is, I mean, because families could make you could make almost a day of things too. I mean, you could cycle, you could go and get lunch, you can cycle home, you could take a picnic with you. I think, and Greensboro has amazing street art.
Yeah, it really does.
They should do a greenway around street art.
Yeah, yeah.
I think that's one of my favorite things about Greensboro is its street art scene.
Yeah, and that's been one of the fun things too about, so the downtown Greenway has 4 different cornerstones. So essentially, marking points, and each one has its own, or will have its own sort of art piece that's a feature of that space. And so that's, kind of the Greenway planners too, of having that vision of being able to pull in, not just the ability to walk, but actually to pull in, more community pieces.
Yeah, and this passion of yours ties in with your focus on whole person health, because you see the big picture and you also want to share your skills with your community.
Yeah, absolutely.
What does health mean to you?
That's a great question. Yeah, it's certainly one of those things that kind of changes with each, I guess more with each decade and two. In my 20s, I would have defined it certainly differently than I do now. But I think that when I think of health now, I think of it more as the capacity to do things that are meaningful. And I think capacity is a good word for that, because I think of like the classic World Health Organization has a document on health and stuff like that. And it's a lofty goal. I can't remember the complete verbiage, but I think it's like, the complete, spiritual, physical, mental domains, as well as the absence of disease.
Yeah, you're almost exactly right. It's a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. And that is like, I think it's really old too, that definition, 1948.
Yeah, I was about to say, it feels like it was the 40s, which is a bit progressive when you think about it, the definitions of health at that time. But yeah, I think of health a lot as capacity, because it's easy if you only define it as like, I'm going to feel 100% every day. Well, that's really discouraging. But if you have the capacity to kind of work towards your goals each day, and the capacity to even, reach some of those, I think that's a more sustainable goal. And maybe I'm just thinking that now as like kind of getting into my 30s, I kind of think more along the lines of like, what my health, as far as like different components of it, I think of it personally more of like, what is something that's a sustainable arc for the next 30 years versus what's something that I can sustain for 3 months. And I think that there's obviously a balance and a tension with that, of like having some short-term goals and long-term goals. But I think of health just as that ability to kind of keep reaching for what it is that you, the wholeness that you're looking for in life.
Yeah, and a lovely long-term sustainability component. Because oftentimes people, they do look at health very short-term, and that's the problem with just focusing on the number on the scales. And it's often a very short-term goal, or, we're coming up to the new year now.
Yes, we are.
And when people make these lofty goals or resolutions and they join the gyms, again, the gyms love it. Because they often hook them into a year contract and they know they won't show up. So they just make money every month for doing nothing.
Right.
But again, I love that. And that's the beauty of walking, particularly of these kind of activities. You can do it no matter what your age is.
Absolutely. Yeah. Yeah, absolutely. And it becomes, and it can become by definition a more communal event. I saw a commercial the other day for, a Peloton bike, and I have no issues with the company itself, but it's more of just an interesting kind of case example of somewhat how we view health in this country. And that's a bit of like an individualistic standpoint of like, health is what I'm going to go and do in my workout room, in my house. And it doesn't always have communal, relational aspects, as well as like accountability aspects of, and like you said, with walking, it's something that you can go and do with friends or family, and have benefits, physical as well as relational.
And in the pandemic years that we're in, unfortunately, I mean, that is just the reality of it. It's a safe way to do it.
Absolutely. Yeah.
You can have the peace of mind that you can have more social aspects in a very safe way.
Exactly.
Yeah, the Peloton thing is a fascinating concept, because I think a lot of people always read that they made these purchases and they regretted them.
Yeah.
Yeah, I don't want to stir the pot too much, but it's very, very expensive and very almost out of reach for many.
Sure.
But like a cheap run-of-the-mill stationary bike will do exactly the same thing.
Sure.
And so much of movement, which you can elaborate on now, can be done with very little equipment at all. So I feel like that is a barrier too, but it doesn't need to be. Talk about it.
No, absolutely. I mean, and standing here in my clinic, I don't have too much equipment, and sometimes that surprises people. But I have a yoga mat, and kind of hitting back to that point again, that's one of those things that I like about yoga, is that it can be done with minimal equipment. I certainly have weights and stuff like that. Like I really like to focus on like functional movements, like people being able to squat, to deadlift, to pick up things, to be able to lift things overhead. And weights are a great tool for achieving a lot of those goals. But outside of those things, like those are the main like equipment pieces that I have. And one of the beautiful things too is like there's just a lot of information available now, online and stuff like that, of like body weight workouts and stuff like that. Like there's plenty of resources that are available to kind of help people in this, to use their body and not to have to rely solely on equipment.
Yeah, you can do it anywhere, outside, inside, when you're traveling. Yeah, now, a lot of these workouts online are fun. They have music to them. They're short.
Yeah, absolutely.
So that's it. So there's a lot of information online, which can have pros and cons. If you were to give some tips for people how to find evidence-based, safe information, and also if they're having issues, what should they look for when they're looking for a physical therapist?
Yeah, those are both great questions. Yeah, I mean, I think as far as like finding information online, it kind of hits back to some of the main themes we've been talking about already, which is one, I like look for people that are emphasizing functionality. And for those that aren't in either my field or more the training field, functionality has certainly become a bit of a buzzword. But at its core, it's basically saying like, what are movements that, kind of work whole body. So I know I mentioned like, deadlifting and stuff like that. And people sometimes think like, oh, I'm not looking to do weights or anything like that. But it doesn't have to necessarily be a weight, because if you've ever been to the grocery store and had to pick up your bags, you're doing some deadlifting. And like you said before, if you're putting stuff up in a cabinet, or maybe like this time of year, if you're getting down your holiday decorations, these are all things that require, strength and mobility and stuff like that. So I would just encourage people that are looking for stuff like that to focus more on something that is more full body working, as well as someone that's kind of looking at movement through the lens of the movement being the end and not, a physical change. I think your second question was what to look for in a PT.
Yes.
So I would say, again, kind of going back to the goals question of like, what are you looking for? And what is that physical therapist offering? I tell people often I will, before someone comes in for the first time, I'll talk to them for, 10 minutes on the phone. And that's something that I offer to everyone. And it's more of a way to acknowledge, like, not every physical therapist is right for every client and vice versa. And so just to if you're looking for a physical therapist, I would say like reach out to them and see if you can't talk to them and kind of tell them like what you're looking for, what you're hoping for, and to make sure that there's alignment with their philosophy and your philosophy. And if someone's not willing to talk with you, via email or on the phone, that might be a bit of a yellow flag that might not be someone that's going to be able to offer the personalized care and that that you should be looking for.
Yeah, and I would emphasize, if you have, like, just before we started recording, you mentioned about pain.
Mm-hmm.
Like if you're really having a lot of pain and it's not going away, or you do have concerns, trust that. Get your doctor to check out, do some tests and check you over, and go to a licensed physical therapist who is well qualified, because you deserve the best.
Mm-hmm. Absolutely. And the great thing too that people don't often know is that in most states, including North Carolina, you can come to me or another physical therapist directly. So we have something called direct access, which is basically like if your shoulder's bothering you and you want to get it checked out, come in and we will take a look at that. And physical therapists are trained obviously in the medical realm. So we have the ability to know like, oh, this is something that we can work with. Or, we also know when to refer out to someone else. So that's a good resource too for people here.
Things.
Mm-hmm. Absolutely.
Because of your medical training, you have an ability to maybe say, oh, you need to ask your doctor about this, or did you notice this before? Whereas maybe somebody else wouldn't have that skill set.
Absolutely. Yeah. And that's kind of one of the first things when someone comes into my office is that I'm asking, like, does this person belong here? Or would they be better suited with another practitioner?
Well, that's awesome. I love your approach, and I like your holistic and community approach. It's a beautiful thing that you care so much about where you live and getting people moving in a just fun, connecting to nature. Where can people find you and learn more about you?
Yeah, so I guess with most people, I'm on social media, and I do try to do a pretty good job of posting consistently there. I'm both on Facebook and Instagram. The name of the practice is Gate City Physio, and that's the my handle on both of those is Gate City Physio. As well as obviously I have a website, and you can just search Gate City Physio in Google and find me there. And if people have questions, feel free to reach out to me directly, and I'd be happy to talk with you on the phone or email, whatever is best, just to kind of get an idea of what your goals are and if we'd be a good fit to work with each other.
Thank you so much.
Yeah, thank you, Rebecca. Enjoyed it.